The governor making a stop in Kalamazoo today. She was promoting her plan to create affordable housing. This for up to 6,000 people statewide and create as many as 1,600 jobs in the process.
Political reporter Rick Albin spoke with the governor one-on-one about that and parts of her jumpstart plan for the economy and what might happen to the rebound of COVID variants becoming a bigger problem.
Governor, over the past few weeks, you have been rolling out a number of programs that you call your economic jumpstart, the most recent of which is about affordable housing. I want to talk about some of those other issues in a moment, but let's talk about that one specifically because this is targeted at an issue that we have seen statewide, but certainly in metro areas where affordable housing is very, very limited. What is your plan?
So this is a $100 million investment that we're proposing to go into our ability to think creatively and to work with locals to improve and expand affordable housing across Michigan. This is something that was created. It was a bipartisan effort. In fact, when I was in the legislature, Jerry Coyman from Grand Rapids was a big proponent of this because we know that this is a core need in our economy. This predated the pandemic, obviously, but throughout the pandemic, it has come into even sharper focus. And that's why we really want to make sure that Michigan has all the tools we need to expand affordable housing. Housing insecurity is a huge problem for a lot of communities all across the state. And this is an important way we can get people to work on improving that and expanding on our ability to provide that most crucial fundamental need for so many families.
You have talked about recovering from this pandemic, and we have, as the summer has started to progress, we see things that feel not completely normal, perhaps. Maybe they never will be completely normal, as we once knew, but they feel more normal out there. But I want to read something to you here, if I can find it quickly. This was from Dr. Caldoon, and she tweeted yesterday, "I am supportive of today's CDC guidance, universal masking in schools, and mask indoors in public spaces, even if vaccinated, when transmission is high, is what we need to do right now." What does that tell us going forward? Are we getting ready to get back into a circumstance where we're going to see mask mandates and other procedures that we thought we had left behind?
Well, I think that what we've learned over the last year and a half is that we have more to learn, right? This is a virus that is novel. We know a lot more about it than we did a year and a half ago when we were really seeing our first surge. We have vaccines that are available, that are easy to access, that are life-saving. So we look at hospitalizations across the country. The people that are really sick are the ones who are unvaccinated, and that's why we're really redoubling our efforts to encourage people to get vaccinated, whether it's the sweepstakes or it is an opportunity to get vaccinated in your own home or at your local church. We're making it easier and easier for people to access vaccines. It really is a modern miracle, and it is the thing that can keep us engaged in the way we all want to be, but also safe. I am going to be wearing a mask more often when I am inside, and especially when I'm in crowded places, I'll be masking up, not because I don't have complete confidence in the vaccine that I've taken, but because I know that there are some of us who cannot get vaccinated, like people who are immunocompromised, and my masking up can help keep them safe, and it's an easy thing for me to do to try to make sure that those who are vulnerable are safe.
Well, it's one thing to do that voluntarily, and I appreciate that. On the other hand, the question is, and it really dovetails with this economic recovery. I mean, if we get to a situation where, once again, we're going to be in some type of mandates to do some type of quarantining, I don't mean in total, but masking or whatever it is that a detriment to the recovery, or is this just another step in this progress?
Well, we know that public health and economic health are inextricably linked. We have all seen that play out over the last year and a half. And that's why as we see this Delta variant increasing across the country, our numbers are still relatively low here, but the trajectory is similar to what we're seeing in other parts of the country. We need to keep our eye on that. We need to work together to get more people vaccinated, and we need to all do our part, whether you are vaccinated or not. If the guidance from the CDC is you should be wearing a mask when you are in crowded places, we're asking that people do that. I would anticipate that that will continue to come in the form of guidance from DHHS and Dr. Caldoun. I don't anticipate more epidemic orders, but of course, it's hard to say that that could never happen, but I'm hopeful that if more people get vaccinated and if those of us who are paying attention can mask up when we are inside, that we can keep these numbers at bay. But it still is a very real threat, and future mutations are a potential threat as well, and that's why we've got to keep our eye on the science.
We're out of time, Governor, but before I let you go, same will be true for schools. It will be guidance, not mandates.
At this juncture, school districts are coming up with their policies. We've given guidance. We've also given a blueprint to how to meet the needs of our students, and we've given them an incredible amount of resources to do just that. And so I'm hopeful that school boards, as they are resuming the school year, are mindful and following the CDC guidance as well.
Governor, thank you for your time.
Thanks, Rick.